Hello everyone, I'm Clesia Fernandez. Welcome back to my YouTube channel Nursing Lecture Series. In the last video, we discussed the meaning, definition, and introduction of growth and development. If you haven't watched that video yet, make sure to check it out first. The link is given in the description. In today's class, we will move forward to another important topic, which is the principles of growth and development. And these principles help us understand how a child grows and develops in a systematic and predictable way. If you find these classes helpful, please like the video, share it with your friends, and subscribe to the channel for more nursing lectures. Now, let us start today's lesson. Now, let us learn the principles of growth and development one by one. Well, the first principle is development involves change. Okay, so human being undergoes changes from the moment of conception to the time of death. So these changes may occur in size, body proportions, abilities, and behavior. And during development, what happens is some old features disappear and new features are acquired. For example, a newborn baby has primitive reflexes like the Moro reflex. Okay, but as the baby grows, what happens? These reflexes gradually disappear. At the same time, the child begins to develop new skills such as sitting, crawling, and walking. This clearly shows that development always involves change. Okay, so the second principle is development is a continuous process. Okay, what does it mean? Development does not happen suddenly or at one particular time. It continues throughout the life of an individual. So development occurs through interaction with the environment, including family, society, and learning experiences. Each stage of development prepares the foundation for the next stage. For example, before a child can draw or write, the child must first develop hand and finger control. After gaining this control, the child slowly learns to hold a pencil and write letters. In the same way, skills and knowledge develop gradually over time. So, overall, growth and development occur continuously and step by step, with each stage helping the child progress to the next stage. The third principle is development follows a direction and a uniform pattern. Okay, so this means development happens in a particular order and one stage needs to be achieved before moving to the next stage. I'll give you one simple example. A child cannot run before learning to walk and cannot walk before learning to stand. Right. So development always follows a sequence. So there are two important patterns in this principle. As you can see here, proximodistal principle and cephalocaudal principle. Now, what is this proximodistal principle? So according to this principle, development occurs from the center of the body to outward. Okay, so that means here the child first gains control over the spine, the shoulders, then the arms, and then the hands, and finally the fingers. Okay, so this is why babies can move their arms before they can control their fingers for fine movements. And the second pattern is cephalocaudal principle. So this means that development occurs from head to toe. Okay, it occurs from the head to toe. For example, a baby first gain control over the head and neck, then the arms and trunk, okay, and finally the legs and the feet. So this is why a baby can hold the head up before learning to sit, stand, or walk. Okay, so overall development follows a definite direction and pattern, moving from head to toe and from the center of the body to outward. So that's the third principle. The fourth principle is development is unique. This means that development is different for every child, right? Each child grows and develops in their own way and at their own pace. So children may have different abilities, talents, and characteristics. For example, one child may start talking very early while another may take longer. Okay, so both children are normal. They are just developing at different rates. Another example is learning skills. Some children may learn a song after hearing it once or twice, while others may need more time, maybe days or even months, to learn the same song. So, this principle tells us that every child is unique and their growth and development may not be exactly the same as the other children. The fifth principle is development depends on maturation and learning. Okay, so maturation means the natural growth of the body or the natural biological growth. That means as the child grows, the body organs like the brain and nervous systems also develop, right? So which help these help the child perform different activities. For example, when the brain develops, the child becomes able to sit, stand, and walk. Learning means what? Learning means the skills and knowledge that the child gains from experience and from interacting with the environment. Okay, so I'll give you one simple example. A child learns language, behavior, and social skills. How? By observing and interacting with the parents, teachers, and other people. So, both maturation and learning are important for child's development. When a child grows in a good and supportive environment with proper care and opportunities to learn, it helps the child develop better and faster. So that's about the fifth principle. The seventh principle is the development becomes increasingly differentiated. Okay, reaction of the child differs according to the situation as he grows older. So what does this mean? As the child grows older, the child's responses and reaction become more specific according to different situation. Okay, for example, an infant may cry for almost every need, such as hunger, discomfort, or the need for attention. But as the child grows, what happens? The child learns to express the needs more clearly, right? How it will express? By using words, facial expressions, or gestures. Okay, so with the growth, the child's reactions become more specific and meaningful. Then the next principle is development becomes increasingly complex. Okay, so development becomes increasingly complex. That means starts from simple and gradually goes to or gradually go to complex state. Okay, so here development usually starts from simple activities and gradually becomes more complex as the child grows. For example, before a child learns to walk, it crawls, then sits and stands without the support. Okay, so development always moves from simple to more complex abilities. The sixth principle is development is predictable. Okay, this means that development usually follows a certain pattern that we can expect, or development happens in a known pattern. Okay, we can know what is the next stage. Okay, even though every child grows at their own speed, the order of development is usually the same in every children. For example, in speech development, okay, in speech development, a baby first makes sounds or babbles, then starts saying single words, and later begins to speak short sentences. In the same way, height and weight is also predictable. Okay, height and weight also increase in a predictable pattern as the child grows. So human develop okay, so human development is generally divided into different stages. These include the prenatal stage, infancy, childhood, adolescence, and adulthood. So, even though children may grow at slightly different rates, the general pattern of development is usually predictable. Then the ninth principle is development is similar for all. Okay, this means that most children follow similar pattern of development. Even though the speed of development may vary, the sequence of development is usually the same for all children. Okay, in other words, every child generally passes through similar stages of development where one stage leads to the next. Okay, for example, when children learn to draw, they usually draw simple shapes like a circle first and only later learn to draw more complex shapes like a square or triangle. So while each child may develop at their own pace, the overall pattern of development is generally similar for all children. So, to conclude, the principles of growth and development help us understand how children grow, change, and develop step by step. Even though every child is unique, development usually follows a certain pattern and sequence. So, understanding these principles is important for us as nurses because it helps us assess whether a child's growth and development are normal and provide appropriate care. So, with this, we come to the end of today's topic on principles of growth and development. In the next class, we will study about factors affecting growth and development, which will help us understand what influences a child's growth. Okay, if you would like to learn more, you can check the link in the description for additional notes and references. If you found this session helpful, please like, comment, and share the video. Don't forget to subscribe for more nursing and child health topics. Thank you for watching.